Hello students, Instructor Hannah here for Chapter 1, Lesson 1.1, the medical record. So the medical record is a written or electronic record of important information regarding a patient. And the patient is an individual receiving medical care. The medical record functions to make decisions regarding the patient's care and treatment, to document results of treatment and patient's progress, to communicate information to authorized personnel in the medical office, and it serves as a legal document. Again, the medical record is a legal document. The law requires that a patient's care and treatment be documented correctly. Good documentation is critical to legally protect the healthcare provider and their staff. Incomplete records can cause serious problems. They may be used as evidence to show that a patient did not receive quality care, which is malpractice. Information is strictly confidential. It must not be read or discussed with anyone not directly involved in the care of the patient. This brings into play the HIPAA privacy rule. HIPAA stands for Health Insurance Portability and Accountability Act. This is a federal law that protects the patient's privacy. It went into effect April 14th, 2003. The purpose is to provide patients with more control over the use and disclosure of their health information, which is known as PHI, Protected Health Information. Who must comply with the HIPAA privacy rule? Anyone that uses, stores, maintains, or transmits health information, such as healthcare providers, health insurance plans, and healthcare billing services. There are very severe civil and criminal penalties for non-compliance with HIPAA law. Typically, most medical offices have a Notice of Privacy Practices, the NPP. This is a written document created by the medical office that explains to the patient how their PHI will be used and how the medical office will protect it. What is PHI? This is health information in any form. So it could be written on a chart or even on a piece of paper or printed out from the computer. It could be electronic, so on the health record, electronic health record, and it can be spoken and oral information. So if I'm talking to my coworker about my patient and their health information, that is protected. And this PHI contains patient identifiable information. So it could be the patient's name, their social security number, their telephone number, their address, insurance information, anything that could be traced back to the patient. A reasonable effort must be made by the medical office to provide that Notice of Privacy Practices to each patient. And typically the patient must sign and return the form, and the medical office will retain that. Written consent for use or disclosure of PHI is not required for medical treatment, such as if a patient's referred to a specialist, emergency care provided at a hospital, and laboratory tests performed on a patient. So if your primary care provider is referring you to a specialist, they can release your medical information to assist the specialist. The emergency department can release information regarding your visit to your primary care provider to assist them in treating you after you've been to the emergency room. And your primary care provider can release information about your health to the laboratory or radiology to assist them in performing the test. So anybody regarding payment, so determining eligibility for insurance benefits. So this means that your healthcare provider may give PHI to your insurance company to assist in determining your benefits or getting a prior authorization so that they can give payment. And reviewing services provided for medical necessities. So the insurance company may ask for additional information before they will pay for something. And then any healthcare operations within in-house, such as quality assessment activities, contacting patients with information about their care or treatment, reviewing employee activities, and training healthcare students. Patients have the right to access their own medical records and request changes if they believe there are inaccuracies. So this medical record belongs to them, and the owner of it is the office, the medical office. So they are responsible for protecting the PHI from inappropriate access and must make every effort to limit the use of, disclosure, and requests for PHI to the minimum necessary required to take care of the patient. So a request from insurance company for procedures performed on the patient, we can release that information, but we're only going to release the minimum amount necessary that the insurance company needs. And patients have a right to request an account of the transfer of their information for any purposes other than the treatment, payment, or healthcare operations. Businesses to whom the medical office discloses PHI must respect the HIPAA privacy rule, and the medical office must have written agreement with each business to handle the PHI in accordance with HIPAA law. So that might be medical laboratories, transcription services, law firms, accounting firms, software and hardware consultants, and billing services. So the medical office must implement for all employees a basic training program on privacy and security of PHI. So typically you'll go through a training refresher every year. It'll be titled HIPAA or privacy training. So the components of the medical record. The medical record consists of numerous documents, pre-printed forms, and also computer templates. Each has a specific function or purpose, and these documents are usually classified into the following categories: administrative, clinical, laboratory reports, diagnostic procedure reports, therapeutic services, hospital documents, and consent documents. So let's look at each of these. Administrative documents. These contain information necessary for the efficient record-keeping management of the medical office. And they would include the patient registration record, the notice of privacy practices acknowledgement form, and any correspondence not having to do with clinical information, such as correspondence with the insurance companies, attorneys, with the patient themselves, patient referral letters, and collection letters. The patient registration record consists of demographic and billing information. Usually all new patients must fill out this form, and typically the staff will enter the information into the computer. And the information is used for computerized functions such as scheduling appointments, posting patient transactions, processing patient statements, and insurance claims. Demographic information consists of the patient's full name, address, phone, such as home, work, and cell, their date of birth, their gender, marital status, and their employer. It will also consist of the billing information, which is the name of the responsible party. So that would be the name of the insured. So for example, I am under my husband's insurance, so he is the responsible party, okay? And then the patient's social security number, the address of the responsible party. So an example, you might have a a child or adult child who can still be covered under their parents' insurance, and their address might be different. And then again, the name of the insured, so that would be the patient probably. And then the insurance company, typically you would want to get a copy of the insurance card like this, which includes the policy and the group number. Often the medical office will take a copy of the Social Security card as well as the patient's identification card or driver's license if they have one. Clinical documents. These are records and reports that assist the provider in the care and treatment of the patient. Typically include a health history report, physical exam report, progress notes, medication record, consultation reports, and any home health care reports. Oops. There we go. So the health history report is a collection of subjective data about the patient. Health history is obtained by either having the patient complete a pre-printed form, or it can also be filled out by the provider or a medical assistant during an interview, a one-on-one interview with the patient. A thorough history is obtained on every patient when they're new. And then in future visits, this provides information regarding changes in the patient's condition and treatment. The physical exam report includes an assessment of each part of the patient's body. The purpose is to provide objective data about the patient, and it assists the provider in determining the patient's state of health. And typically includes a summary of the provider's findings from each part of the patient's body. Progress notes, the purpose is to update the medical record with new information each time the patient visits or phones the office. So this would document the patient's health status from one visit to the next. It must include the date and time and the signature and credentials of the person making the entry. The medication record contains detailed information on the patient's medications. This includes prescription medications and over-the-counter medications. You'll usually see that referred to as OTC, over-the-counter, and then medications that are administered in the medical office. Most offices use two different forms, one for prescription and over-the-counter meds, and one for medications administered in the office. The consultation report is a narrative report based on the clinical opinion about a patient's condition. And this is usually by a consultant other than the primary provider, so a specialist such as a cardiologist. And the consultant's opinion is based on the review of the patient's record and an examination of the patient. Home health care reports. This is when a patient is visited by home health care. Could be medical and non-medical care in the patient's home. Home health care always must be ordered by a provider. And the purpose is to minimize the effect of disease or disability on the patient by promoting health, maintaining health, and restoring health. So typically a patient must be unable to leave the home for this care to qualify for home health care. So home health care could include nurses, aides, dietitians, physical therapists, occupational therapists, speech therapists, and social workers. Typically, once the patient is no longer homebound and recovers well enough to leave the home, home health care is usually discontinued. The services could include cardiac care, infusion IV therapy, respiratory therapy, pain management, diabetes management, rehabilitation, and maternal child care. A home health care summary report is sent to the patient's provider and may include observations and evaluations, type of care and service provided, medication instructions given to the patient, safety measures recommended for the home, diet, and the activities that are permitted. Okay, a laboratory report is an analysis or examination of body specimens. The purpose is to relay the results of lab tests to the provider to assist in the diagnosis and treatment of disease. Categories include hematology, clinical chemistry, immunology, microbiology, histology, cytology, parasitology, and urinalysis. A diagnostic procedure report would report the procedure performed to assist in the diagnosis, management, or treatment of a patient's condition. This is performed usually by a provider, an MA, or a trained technician. Interpretation of the results made by the provider, and they complete a written report. The written report includes a narrative description and interpretation of a diagnostic procedure, as well as clinical data. Types of diagnostic procedure reports could include electrocardiogram report, so an EKG, that's what this is right here, a Holter monitor report, spirometry, colonoscopy, radiology, diagnostic imaging. Those are just some examples. Health history, physical, lab, and diagnostic tests are all used to determine patient's state of health and arrive at a diagnosis. Diagnosis is the scientific method of determining and identifying a patient's condition. So this is used to prescribe treatment and document change in a patient's illness after treatment. Therapeutic service reports document the assessments and treatments designed to restore a patient's ability to function. Therapeutic services include physical therapy, use of physical agents to restore function and promote healing following an illness or injury, such as therapeutic exercise, thermal modalities, hydrotherapy, electrical stimulation, and massage. Occupational therapy helps the patient learn new skills to adapt to a disabling condition to enable the patient to perform activities of daily living, ADL, and achieve as much independence as possible. Speech therapy is treatment for the correction of a speech impairment, maybe resulting from issues at birth or complications, disease, injury, or previous medical treatment. Hospital documents. These are prepared by the person responsible for the care of the patient in the hospital, known as the attending provider. Typically now, that would be a hospitalist. Okay, the attending provider is known as the hospitalist. And that is the provider who's going to follow the care of the patient throughout their stay at the hospital. And this is an original document kept on file at the hospital, but copies can be sent to the patient's provider. And this assists the patient's provider in reviewing the patient's hospital visit and then providing follow-up care after discharge. So examples of hospital documents are an H&P, history and physical report. This is done for anybody who is admitted to the hospital, so going from an outpatient status to an inpatient status. That's typically done by the hospitalist. Medical impressions, such as a tentative diagnosis, those are conclusions drawn to the patient's state of health. Then you would include an operative report if there's any surgical procedure performed, and that must be completed on all patients having surgery. You would, I'm going to skip here a little bit because typically the discharge summary comes at the end. So then you would have your pathology report, so description of any tissue removed and diagnosis. And you would also include any diagnostic reports, so any tests that were performed at the hospital, such as laboratory or any kind of diagnostic procedure. Those will each have their own report. And then you would have your discharge summary at the end of the inpatient stay, which is a summary of all events that occurred during the patient's hospitalization, and then their basically prognosis and any home instructions or follow-up instructions. There's usually a separate emergency department report that's obtained during the ED visit, and then that can be on its own, or that might preclude the H&P if the patient was admitted to the hospital. And typically the hospital will send copies to the patient's primary care provider. Consent documents. These are required to perform certain procedures. Pretty much all procedures require consent. And this is a release of information contained in the patient's medical record. And the types of consent forms are consent to treatment, and then a release of medical information consent. So the consent to treatment form is required for all surgical operations and all non-routine therapeutic and diagnostic procedures. This form is signed by the patient or their legally authorized representative, and this provides written evidence that a patient agrees to the medical procedures listed on the form. Not only that, it means that they are attesting to the fact that they understand the risks and benefits prior to signing the form. Okay, so this is known as informed consent. This means that the patient has received the following information before giving their consent. So the nature of their condition, the nature and purpose of their recommended procedure, the risks that are involved, and alternative treatment or other procedures that might be available. And then the prognosis, which is the likely outcome of the procedure, and then any risk of declining or delaying the procedure. So the consent to treatment form must be in language and terms that the patient can understand. So if it needs to be translated, that has to be done to make sure that the patient fully understands. And the patient must be given the opportunity to ask questions about the form. And it should not be signed until the patient has been provided with all of that necessary information on the previous slide. And the patient's signature must be witnessed. So usually that is the medical assistant's job to verify that it is the patient or the patient's authorized representative who is signing the form, and they actually watch them sign the form. Now, this does not mean that the medical assistant is attesting to the accuracy of the information on the form. That is up to the provider who is performing the surgery or procedure. A release of medical information form. This is not required for medical treatment, payment, and healthcare operations. So TPO, treatment, payment, operations, as stipulated by HIPAA, we talked about earlier. But it is required for purposes that are not part of treatment, payment, or healthcare operations, such as if the patient moves to another state and transfers their records, or if the patient decides to switch physicians or providers, then they must sign a form, and they can mail it or fax it if they're unable to come into the office. And this has to be retained on file before the medical office can release the information, the PHI, to whoever the patient has authorized to receive it. Okay, that concludes lesson 1.1.